Սիրելի բարեկամներ, այսօր դարձել մեր հեռուստահանդեսի հյուրն են հայ բժիշկները իրենց օգտակար խորհուրդներով։
Hi and welcome again to AAHPO's American Armenian Health Professional Organization's TV Health Program. Today's program is about dentistry and dental health, and I have with me Dr. Artur Kubikian, who is Vice President of AAHPO, and he is Clinical Assistant Professor of Endodontics in NYU College of Dentistry, and is private practice in Queens and Nassau. Welcome, Dr. Kubikian.
Thank you, Dr. Karatokla.
Well, today's program is obviously about the dentistry. Let's talk about the recent advances in dentistry. What kind of recent things are up there that we don't know you want to tell us?
Well, I think rather than recent, let me just say that the key advances in dentistry,
That's better.
Let's say in the past 100 years, have
Yes.
been number one, pain management, local anesthetics,
Yes.
Use of antibiotics. I mean, people used to die from dental infections in my lifetime.
Right, antibiotics after 1945 anyway.
That's right. And also, and of course, the use of dental x-rays.
X-ray, right.
Which have been widely available, specifically in the first world countries. And of course, we're very fortunate to live at times when these and other advances are available, whether they're dental implants, which are of titanium,
Right.
and whether it's the use of ultrasonics, whether it's the use of bonding materials and cosmetic dentistry.
Right.
So these are some of the more exciting
Advances.
things recently
Right.
that is going on. Of course, not all of these things are available in the third world countries. Unfortunately, or the fourth world countries.
For just practical purpose, I'm going to ask. Dental fillings was, in the past, different material. Now,
Yes.
because it was a kind of toxic or so, what kind of feeling we have now for the dental fillings?
Well, you know, the National Institute of Health, the dental research program, they have shown that there is no harm in using amalgam, which is a combination alloy of different metals, including mercury and zinc and tin and silver and copper. However, the tendency has been that lately we're just using white fillings, which are mainly methyl methacrylate, to which is added literally sand, very fine sand, which makes it extremely tough, and also they're very aesthetic because they're tooth color.
Do you do implants at all?
I restore implants.
Okay.
Nowadays, implants are extremely successful.
Right.
35 years ago, when I was starting to be interested in implants, they used stainless steel, and they all failed. However, nowadays, dental implants are titanium. They started using them first for hip replacement and knee joint replacement and shoulders. And after that, they use it for dental purposes.
Really, yes.
And titanium seems to be very inert. I think that the chances are that over a 12-year period, 90% of the implants on a population basis are still there. So it's an extremely successful procedure.
Is there any age group? Is there an age group that we can do implants, or it could be anybody?
I think any age group, provided that the patients are not immunocompromised, that they're not heavy smokers, that they're not uncontrolled diabetics, and that they don't have an inherent tendency or susceptibility to periodontal disease, because just as you can get periodontal disease with normal teeth, you can also get peri-implantitis, it's called. You can get gum disease and bone loss.
How about osteoporosis now? If somebody has osteoporosis and needs dental implant, what do you do?
Well, again, it's a case selection. You want to be successful, you have to select the right case.
Because there was a case that with the people that with osteoporosis taking Fosamax type of medication, they had problem with their jaws.
Absolutely.
If they're on Fosamax
Biphosphonates,
or biphosphonates, you avoid those people.
There is a lot of problems with healing. Certainly, if you have an open wound and you go in there and put implants, or if you have an extraction, there is a problem with not healing, especially people that have been on IV type bisphosphonates.
Right. Okay. Now I'm going to come to bread and butter. I'm sure they're going to ask and they want to hear what kind of dental floss we should use, what kind of dental toothpaste we should use. Give us a little information.
Well,
let's start from toothbrushes. Now I have mine is electrical.
Okay.
And I feel much better when I use electrical toothbrush than versus the hand-used toothbrush.
Right.
It might be psychological. Tell me, is it good or bad?
Well, no, they're great, provided that you have toothbrushes that are nylon, soft, and with round-ended bristles.
Okay.
There is absolutely nothing wrong with electric toothbrushes.
Okay.
The idea of the toothbrushes is to remove the plaque or bacterial biofilms on the outside surfaces, but brushing with electric or regular toothbrush should be done twice per day.
Twice per day.
But also you should floss once per day, because most gum problems, most caries happen in between the
In
teeth.
between teeth. And that toothbrush cannot take it out. So
That's
we need to
correct.
floss the teeth.
And of course nowadays what's being recommended, using water jet water pick, because they found out that as that pulsates the mouthwash in between the teeth, it creates what's called the Venturi effect, and literally pulls out the endotoxins from the subgingival bacteria.
How about the toothpastes? Any of them are particularly important? Or
I particularly recommend those who are susceptible to high cavity situations to use Prevident toothpaste. Prevident 5000 booster. It is the only toothpaste by prescription. And the reason we recommend fluoride toothpaste is because they replace the weak ions and the calcium phosphate makeup of the teeth. Especially those who are susceptible, for example, people that have had head and neck radiation. You know, their salivary glands don't work well. They have dry mouths. People that are on antipsychotic medications have dry mouth, and so we recommend that for them, and it can make a big difference because immediately the tendency to cavity formation will subside.
Will subside. Oh, that's a little cosmetic now. How about tooth whitening? What do we do? What do you do there?
Well, tooth whitening has been around for the past, I think, 12 years, and everybody was concerned that maybe the whitening will go through the enamel and through the tubules of dentin and go to the nerve and cause nerve damage. However, it's been shown that there is no such thing, and there are a number of ways you can use over-the-counter items. It takes a little bit longer, like Crest white strips. You can have a different hydrogen peroxide concentrations for home use, or high concentrations are used in the office. Sometimes a light is placed, which supposedly helps whiten the teeth, and it does work well. The biggest problem is that there is a relapse. So if possible, the dentist should make a small trays for the teeth, so that once a week or maybe once every 2 weeks you'll use that material so that you don't lose the whiteness of the teeth.
Okay, so thank you for coming. Hopefully we'll have another session that we'll go over more again.
Great.
Thank you for coming.
Nice being here.
Now it's the time for Article of the Week. This article is about vitamin E and pancreas cancer in male smokers. Pancreas cancer is third among men and fourth among women, leading cause of cancer in the United States. Major antioxidant effect of vitamin E is to prevent cell damage by fighting free radicals. Cigarette smoke has been shown to change vitamin E utilization and decreases the level of alpha-tocopherol in blood. Therefore, smokers are susceptible to low vitamin E levels than non-smokers in their blood. The conclusion of this analysis was higher vitamin E concentrations in the blood may play a protective role in pancreas cancer in male smokers. So, if you are a smoker, male or female, you can decrease the chance of getting pancreas cancer by quitting smoking. And make it sure that you have enough vitamin E intake. Again, vitamin is in vegetable oils and seed oils. I'd like to remind you to visit AAHPO's website, which is loaded with health informations. And good health is precious and priceless. Take care of yourself. Until next program, good night, Kshepari.